Okay, let's unpack this. If you share your life with a cat, or maybe a whole clouder, this deep dive is absolutely for you. We are plunging into a topic that is incredibly common, frustratingly complex, and often heartbreakingly completely silent.
Yeah.
We're talking about feline tooth resorption.
It's a condition that affects a huge percentage of cats, causing significant pain that they are just, unparalleled masters at hiding.
Totally.
And one of the most surprising aspects is that, unlike the cavities you or I might get, it's fundamentally not caused by bacteria.
Right. That distinction alone was one of the key insights we pulled from the material provided for this deep dive.
Definitely.
Our mission today is to go through all of it and understand exactly what feline tooth resorption is, just how widespread it is, why it remains, kind of a scientific mystery, how vets actually find it, given how hidden it often is, what the treatment options look like, and critically, what you, as a cat owner, really need to understand about this disease.
Okay, so let's start at the beginning. What is feline tooth resorption?
Yeah, the definition.
Well, the definition we see is basically the progressive destruction of the hard dental tissues, the enamel, dentin, and cementum. And this destruction is carried out by specialized cells called odontoclasts.
Okay, so it's the tooth structure itself breaking down. You might have heard it by older names like FORLs, cervical line lesions, maybe even just cavities.
Right, those old terms.
But the crucial thing here, and it's stressed repeatedly in the sources, is that this isn't like human dental caries caused by bacteria.
No, absolutely not.
It's described more as an immune-mediated or inflammatory process where these odontoclast cells essentially attach to the tooth and just start dissolving it.
Exactly. It's almost like the body is mistakenly attacking its own tooth structure. That mechanism is really what sets it apart.
Wow. And how common are we talking? Because the numbers we saw are pretty, eye-opening.
They really are. The data indicates it's incredibly common. We're talking over 50% of the entire domestic cat population.
Over half.
Yeah. But then look at cats over the age of 5. The sources say nearly 75% of them are affected by at least one lesion.
Wow, 3 out of 4 middle-aged and older cats have at least one of these. That's staggering.
It is. And the impact is significant because it's cited as the most common cause of tooth loss in cats.
Okay, so it's super common, causes tooth loss.
Yep.
But you mentioned the cause itself is a bit of a scientific whodunit.
Absolutely. The precise cause, it remains unknown. Researchers consider it multifactorial.
Meaning lots of things involved.
Exactly. There are likely several contributing factors rather than one single culprit.
So what are the main theories being, explored right now?
Well, a leading idea is that chronic inflammation of the surrounding tooth tissues might be involved, somehow triggering those odontoclasts to get started.
Okay.
The prevalent theory really involves a dysregulated immune response. The immune system basically gets the wrong signal and tells these odontoclasts to start destroying the tooth structure.
Like an autoimmune reaction against the tooth.
Sort of, yeah. That's a good way to think about it. A misdirected immune response.
Are there other potential factors researchers have looked into? Any other leads?
Yes, definitely. Other ideas that have been proposed include things like mechanical stress on the teeth, maybe metabolic issues. Historically, even viral infections were considered, though those seem less supported now.
What about diet? That always comes up.
Diet's been investigated for sure, but no definitive link has ever been proven, according to the sources. The ongoing research is looking really closely at these complex inflammatory processes, potentially involving signals from the body's own immune system, various cells, plaque, toxins, cytokines, proteinases, lots of complex biology.
So a whole lot of complex stuff happening, but no single clear smoking gun identified yet.
Exactly. And that ongoing investigation is just critical if we ever hope to find ways to maybe prevent it or address the root cause someday.
Yeah, makes sense. Now, the material also talks about different ways to understand or classify these lesions. It seems there isn't just one system.
That's right. There are primarily 2 systems used, and they capture different aspects of the condition, which is helpful for vets.
Okay.
One system classifies TR into types type 1, type 2, and type 3. And this is based on what the tooth and root structures look like, particularly on x-rays and sometimes under the microscope if needed.
Okay, tell us about type 1 first.
So type 1 is often called inflammatory TR. As the name suggests, you typically see clear signs of inflammation around the tooth.
Okay.
On an x-ray, you'll see a distinct dark area, what we call radiolucency, where the tooth structure is being, eaten away. But the root itself and the ligament holding it in place usually look relatively normal otherwise. This type leads to significant tooth destruction and is typically very painful.
Got it. Inflamed, actively breaking down. What about type 2?
Type 2, sometimes called replacement TR, is quite different. There's usually less obvious inflammation involved.
Okay.
Instead, the body starts replacing the normal root structure with bone, or a kind of bone-like tissue.
Replacing the root.
Yeah. So on an X-ray, this is where you see that characteristic disappearing root look. The space for the periodontal ligament and even the root canal, they just seem to get obliterated as they're replaced.
Wow.
The root gradually fuses to the jawbone and is resorbed, kind of replaced by bone. The crown, the top part of the tooth, might stay intact for a while before potentially breaking off later.
Okay, so type 1 is active inflammatory destruction. Type 2 is more like the tooth root is replaced by bone and fuses to the jaw. And type 3, simple.
Type 3 is simply a combination. The same tooth shows features of both type 1 and type 2 happening at the same time.
Got it. Okay, that helps understand the process happening inside the tooth. But there's also a staging system mentioned, right? Stages 1 to 5.
Yes, exactly. There's a staging system from stage 1 to stage 5. This system focuses purely on the extent or the depth of the hard dental tissue loss. It's basically a way of describing how far the lesion has progressed into the tooth structure.
How does that progression look through the stages? Like, what's stage 1 versus stage 4?
Well, it starts mild at stage 1, where only the outer layers, the cementum on the root, or maybe the enamel on the crown are affected, just superficial.
Okay.
Stage 2 involves moderate loss that goes into the next layer, the dentin, but it hasn't reached the sensitive pulp chamber yet.
Right.
Stage 3 is when there's deep loss that actually penetrates into the pulp chamber, but the tooth largely maintains its overall shape and integrity.
Getting serious.
Then stage 4 means there's extensive loss of tooth structure. The tooth's structural integrity is really compromised. Often you see a fractured crown or just significant loss of tooth substance at this stage.
And the final stage, stage 5.
Stage 5 is essentially when the tooth is mostly gone. You might only see some irregular remnants on an X-ray, maybe like little opaque blobs, and the gum tissue has completely grown over the site where the crown used to be.
Right.
It's worth noting the sources mentioned the staging system is based on the assumption that the disease progresses through these stages, which isn't always, a perfectly linear process in every single case.
But useful for describing severity. So vets use both systems then. The type, 1 to 3, helps understand the underlying process, and the staging, 1 to 5, describes how bad it is.
Precisely. Both are really crucial pieces of information for making an accurate diagnosis and then figuring out the right treatment plan for that specific tooth.
Now, finding this, that's the tricky part, isn't it? Because you said cats are so incredibly good at masking pain.
Oh, absolutely. It's a huge challenge.
What are the signs owners might possibly see, according to the information, if any?
Well, the big caveat is that many cats show no obvious signs at all, especially in the earlier stages.
Right, silent disease.
Exactly. If signs are present, they are often subtle and might only appear when the disease is quite advanced. You might sometimes see jaw chattering if the affected area is touched.
That little involuntary tremor?
Exactly that. It's a classic sign when present, though not constant. Other potential signs could be a reluctance to chew hard food. Maybe the cat starts preferring softer options or drops food while eating. Sometimes excessive drooling, maybe even bloody drooling. In very severe cases, weight loss can occur if eating is painful enough for long enough.
And behavior changes.
Yeah, behavioral changes can definitely be a clue. Maybe the cat starts hiding more, becomes less interactive, shows irritability, or even aggression sometimes because they're just hurting. Some cats might paw at their face or mouth, or you might notice a reduction in their grooming habits. Maybe their coat doesn't look as good.
Those are definitely things that could be easily missed or blamed on just getting older or something else entirely.
For sure.
What about things a person might actually see in the mouth if they get a look?
Well, if the lesion happens to be visible above the gum line, you could potentially see red inflamed gum tissue that seems to be growing over the affected part of the tooth that's called gingival proliferation.
Like the gum is trying to cover the hole?
Kind of, yeah. It might look like a small red spot or even a distinct hole right at the gum line where the tooth meets the gum, sometimes filled with that overgrown pink tissue. Or you might just see a fractured crown. The top part of the tooth has actually broken off because the underlying structure was weakened so much by the resorption.
Right.
And sometimes you might just notice increased plaque and calculus buildup, maybe just on one side, because the cat is actively avoiding chewing there due to pain.
But the main takeaway, and this is crucial, is that maybe most cats just don't show any outward signs.
Absolutely. A vast number of cats with TR are technically asymptomatic from an owner's perspective, and the lesions are only discovered during a professional veterinary dental examination.
Mm.
There's also some mention in one source about possible breed predispositions, and that certain teeth seem to be more commonly omected, like the lower jaw premolars and molars, and maybe the upper jaw premolars too.
Okay, so if a cat isn't showing obvious signs, how do vets definitively diagnose this? What are the steps?
Right, so the key steps outlined in the material are really essential for a proper diagnosis.
Yeah.
An awake oral exam, just looking in the mouth while the cat's awake. Tricky with cats sometimes. Very tricky. It can sometimes find visible lesions or maybe elicit that chattering reflex if you touch the spot, but it's always limited. You can't see everything, the cat might not cooperate, and many lesions are hidden anyway.
So what's the indispensable next step then?
An oral examination performed under general anesthesia. The sources state this is mandatory for a complete and safe examination.
Why anesthesia?
Well, it allows the vet to thoroughly and safely check every single tooth surface, crucially including the areas below the gum line where TR often begins and hides.
Okay.
They use a special tool, a dental explorer, which has a very fine tip, to gently probe along the gum line of each tooth. If a TR lesion is present, that fine tip will often catch or stick in the defect. And interestingly, even under anesthesia, you might see a little muscle twitch or some reaction from the cat when the explorer hits that sensitive spot, indicating pain.
Wow, even asleep.
Yeah. They also check other things like the furcation, that's the area where the roots diverge on multi-rooted teeth, trying to distinguish TR from other problems like bone loss due to periodontal disease.
Okay, so anesthesia allows a thorough hands-on check. But what's the absolutely critical tool for diagnosis mentioned?
Intraoral radiography, basically. Dental x-rays. The material stresses over and over that this is absolutely essential and definitive for diagnosing TR accurately.
Non-negotiable, sounds like.
Pretty much.
Why are x-rays so critical?
Because, as we've discussed, TR lesions so often start below the gum line where they are completely invisible to the naked eye, even during that anesthetized exam.
Right.
X-rays reveal what's happening with the root structure underneath the gums. They show how extensive the damage is. They help determine if it's type 1 or type 2, which affects treatment. And they can show if there's any associated infection around the root tip or other hidden pathology. The X-ray appearance of type 1, that clear, dark spot or lucency with relatively normal root features, looks quite different from type 2, where you see that loss of the root outline, the apparent disappearance of the root canal, and the ligament space.
And they need to X-ray every tooth, not just the suspicious ones.
Yes, the strong recommendation is for full mouth radiographs, always.
Why the whole mouth?
Because TR frequently affects multiple teeth, and often a tooth that looks perfectly healthy on visual exam, even under anesthesia, might have a significant lesion starting below the gum line that's only detectable on an X-ray.
So you could miss lesions without full mouth X-rays.
Easily. You could treat one obvious tooth and miss 3 others that are just starting. The sources also mention histopathology, looking at tissue samples, is rarely needed for routine diagnosis. And vets also need to consider other possibilities that might cause similar oral pain or inflammation, like generalized stomatitis.
Okay, so the bottom line for diagnosis is it really requires general anesthesia for a thorough exam and full mouth dental X-rays. Period.
That's the standard of care described, yes.
So once it's properly diagnosed, what's the definitive way to treat this? How do you make the cat feel better?
The material is very clear on this. The definitive treatment is surgical intervention. The main goal, always, is to eliminate the source of pain and prevent the lesion from getting worse.
Okay, surgery. What are the surgical options described in the sources?
Well, the most common approach, and often considered the gold standard for pain relief, is extraction.
Just pulling the tooth.
Well, surgically removing the tooth entirely, yes.
Okay.
This is indicated for virtually all type 1 lesions because they're inflammatory and painful. It's also for type 2 lesions that involve the crown or are clearly causing pain or infection, and really any TR tooth that shows signs of infection or significant discomfort.
So how is that done? Is it just like a simple pull?
Not usually, no. It typically involves surgically removing the entire tooth, and the key is making absolutely sure all the root fragments are removed. This often requires carefully lifting the gum tissue away, creating what's called a gingival flap,
Okay.
and sometimes removing a small amount of the surrounding bone to get full access to and remove the diseased root completely and safely. Then the gum flap is stitched back down.
And why is extraction considered the gold standard?
because it completely removes the source of the inflammation and the pain. It's the most reliable way to ensure long-term relief for that specific tooth site.
Makes sense.
And the material is very reassuring on this point, too. Cats adapt incredibly well to eating, even without many teeth. They often have a significantly improved quality of life and a much better appetite once that chronic dental pain is gone.
That's good to hear. Okay, so extraction is the main treatment for most painful or inflamed lesions. But you mentioned another procedure earlier, coronal amputation. When is that used?
Yes, but this is strictly for very select cases of type 2 TR. The criteria listed for attempting this procedure are quite specific and rigid.
Like what?
It's only considered an option when the roots are completely resorbed and replaced by bone, essentially fused to the jawbone, what we call ankylosed.
Right, the disappearing root thing.
Exactly. And there has to be absolutely no sign of inflammation, infection, or any features of type 1 or type 3 resorption visible on the x-rays. The root canal itself must also appear obliterated on the x-ray.
So basically, the root is already gone and part of the bone, and there's definitely no pain or infection associated with it.
Precisely. In those very specific, non-painful, non-inflamed type 2 cases where the root is resorbed and fused, the crown, the top part of the tooth, can be carefully cut off just below the gum line. Then the gum tissue is sutured closed over the site.
And you just leave the resorbed root remnants.
Yes, because in those specific circumstances, it's fused to the bone, and the body no longer recognizes it as foreign tooth structure causing a problem. However, the sources do recommend that even with this procedure, long-term radiographic follow-up, meaning more x-rays later, is a good idea to ensure no complications develop down the road.
Okay, very specific criteria for that one. What about non-surgical treatments? We talked about how it's not like a human cavity, so fillings are out.
Yes, the information is very clear that non-surgical treatments are generally ineffective or provide only temporary palliative relief at best. Filling or restoring true TR lesions, which maybe was attempted in the past, is not recommended. The resorption process just continues underneath the filling, inevitably leading to rapid failure of the restoration and, more importantly, persistent pain for the cat.
So trying to patch it up doesn't fix the underlying problem, which just keeps going.
Exactly. Other approaches sometimes discussed, like using corticosteroids or other immunosuppressants, might reduce the inflammation around the tooth and offer some temporary pain relief.
Okay.
But they don't actually stop the destructive process itself. Plus, they have potential systemic side effects, especially with long-term use, and they are definitely not a long-term solution for the tooth lesion itself.
Right, and just pain medication, like giving the cat painkillers.
Pain medications like NSAIDs or maybe gabapentin can be very helpful for providing acute pain management, say, while you're waiting for the definitive surgery to be scheduled.
Okay.
But they are absolutely not a substitute for treating the lesion itself. They just mask the pain temporarily. Similarly, softening the cat's food might help manage their discomfort with eating, but it doesn't treat the underlying disease process at all.
Okay, so it really boils down to surgery, specifically extraction in most cases, as the key to truly relieving the significant pain these lesions cause.
That's the consensus from the provided material, yes.
Which brings us to the big question I know many cat owners are thinking, can we prevent this? Is there anything you can do to stop it from happening in the first place?
Yeah, that's the million-dollar question, isn't it? Unfortunately, the direct answer, based purely on the information we have here, is there is currently no known way to prevent feline tooth resorption.
Nothing. Wow.
It goes right back to the fact that the underlying cause is unknown and likely multifactorial.
So good brushing, dental diets.
Yeah.
That stuff doesn't help with this specific problem.
Well, routine dental care, like brushing, using dental diets, or chews, is absolutely vital for preventing and managing periodontal disease, gum disease, bone loss around the teeth.
Right.
But the sources indicate it doesn't prevent TR itself. That seems to be a separate process.
Yeah, it is. Yeah, disheartening news for owners.
Yeah.
So what's the long-term outlook then? The prognosis once a cat is diagnosed with TR?
Okay, so the prognosis for eliminating pain and significantly improving the cat's quality of life is generally considered good to excellent, provided that the affected teeth are treated with appropriate and complete surgical intervention, like extraction.
That's the positive part.
Yes. However, the material strongly emphasizes that TR is considered a progressive disease. A cat diagnosed with one TR lesion is highly, highly likely to develop more lesions in other teeth over time.
So it's often not a one-and-done situation. If they have one, they'll probably get more later.
Exactly. It requires ongoing management and vigilance. While TR itself isn't considered a life-threatening condition like some diseases,
Right.
untreated or undertreated chronic pain from these lesions significantly impacts a cat's well-being and overall quality of life. That's the main concern.
So ongoing vigilance and care are really crucial then, even after successful treatment of the first lesions found.
Absolutely. The material highlights the importance of monitoring and follow-up care. This includes things like checking the post-extraction sites to make sure they heal properly. But crucially, routine oral examinations under general anesthesia combined with full-mouth dental radiographs are recommended for all cats, perhaps annually, but especially for those cats previously diagnosed with TR.
Because new ones are likely to pop up.
Exactly. That's really the only reliable way to find new lesions early, often before they become obviously painful or cause major destruction. Owners should also continue to watch for any subtle signs of oral pain, even if the most obvious problem teeth have already been treated.
Right, stay observant. And how should veterinarians communicate all of this complex information to owners? The section on client education seemed to have some key points.
Yes, it really stresses the need for transparency and clarity from the vet side. Vets need to explain clearly that TR is incredibly common, and most importantly, that it is painful, even if the cat is a master at hiding it, that underlying pain is the primary reason we recommend treatment.
Right, focus on the pain aspect.
Yes. They also need to make it very clear that it's not like a human cavity and that fillings or restorations simply don't work because the underlying destruction just continues.
Okay.
They should emphasize that surgical extraction is the definitive solution in most cases, and importantly, reassure owners that cats adapt remarkably well to life without teeth, often eating much better and being much happier once they're freed from that chronic pain.
The x-rays seem like a particularly important point to convey to owners based on everything we've said.
Definitely. Vets need to explain why those dental x-rays are mandatory for diagnosis, explaining that the problem often starts below the gum line and just looking in the mouth, even under anesthesia, is often only seeing the tip of the iceberg.
Got it.
They also need to gently inform owners that it's a progressive disease, meaning their cat is likely to develop more lesions in other teeth over time, which makes that ongoing monitoring with anesthetized exams and x-rays so essential.
And being upfront about the lack of prevention and maybe the costs involved.
Yes, honesty is key. Acknowledging that there's currently no known prevention. The focus really needs to be on the significant improvement in the cat's comfort and quality of life once the existing pain is addressed. Transparency about the costs involved is also important, particularly because proper diagnosis and treatment do require anesthesia and full-mouth radiographs, which adds expense. And finally, mentioning the option of referral to a veterinary dental specialist for particularly complex cases, or if the primary care vet isn't equipped for comprehensive dental surgery and imaging, is also good practice.
Wow, okay, that was a truly deep dive into feline tooth resorption based on this material. Well, it's incredibly common, often completely hidden despite causing significant pain, still mysterious in its underlying cause. Requires anesthesia and those full-mouth x-rays for a definitive diagnosis, and surgical intervention, usually extraction, is really the only way to truly relieve the pain it causes.
Yeah, and perhaps the sheer prevalence of this condition affecting so many cats and the fact that it so often goes unnoticed despite causing real pain, it truly highlights how resilient our feline companions are, but maybe also how vulnerable they can be too.
That's a good point.
It's just such a powerful reminder, I think, of the need for proactive veterinary care, especially including those comprehensive dental assessments under anesthesia to catch and address these hidden issues and really ensure their long-term comfort and quality of life.
Absolutely. Well, this deep dive hopefully arms you, the listener, with the knowledge to have more informed conversations with your vet about your own cat's dental health. Keep that curiosity alive and keep exploring.